kg body weight, every 10 kg body weight. Fine. So when we need to give thrombocytopenia, that means whenever there is decreased number of platelet in the blood, that situation is called thrombocytopenia. Second, if there is bone marrow failure, they are also given when there is massive blood transfusion. Remember, I told you that the platelets begin to get depleted after 24 hours. So if you are giving 10 units of whole blood, practically you are giving 0 platelets. So that is why to correct the loss, घाटा पूरा करने के लिए आपको मरीज को एक्स्ट्रा प्लेटलेट चढ़ाने पड़ेंगे. Fine. Now, contraindications. First, डॉक्टर साहब सभी लोग अपना माइक बंद कर लेंगे प्लीज. Uncontrolled disseminated intravascular coagulation. Fine. So what happens in the disseminated intravascular coagulation? Let's say this is your patient, and in the body of the patient, coagulation here, there, everywhere. Fine. Now, this could be due to sepsis. What you should do is, you should first control disseminated intravascular coagulation. You should first control sepsis. Fine. Then only you should give platelet. Suppose you don't control the disseminated intravascular coagulation. What will happen in that case? If you give platelets, there will be more coagulation. And your patient may actually die from coagulation. Right? So first control the coagulation, disseminated intravascular coagulation, then you give platelets. It is also not useful in idiopathic thrombocytopenic purpura and thrombotic thrombocytopenic purpura. Now these things, they will be taught in pathology. These two pathologies, they are long pathologies, बहुत समय ले जाएंगे. Fine. So they will be taught in pathology, but we don't use them. But we don't use platelets in these two conditions. We use steroids, we need other medications. Fine. Now, if you give 1 pack of platelets, it will raise the platelet count by 5,000 to 8,000 in adults. So in children, they will raise the count by 20,000. In neonate, 1 pack will raise the platelet count by 1 lakh. Can be raised by 1 lakh. Fine. Now, the storage. So platelet is the only component of blood which can be stored at room temperature. Fine. So what is the storage temperature? 20 to 24 degree centigrade. 20 to 24 degree centigrade. Fine. Now, secondly, let's say this is the platelet. Just a minute, guys. Important phone call, please.
Okay, sir.
Hello. Yeah, just speak up very fast. I'll call you back in 10 minutes. Meanwhile, eat something else. Ask your daddy to make you something. Make something for you to eat. Fine, I'll order the pizza later. Right, bye. Okay, so let's say these are the platelets. If you keep this bag in the fridge, what will happen? The plasma will remain on the top and the platelet will begin to settle at the bottom. Fine. Now these platelets, they will stick to each other and they are destroyed. So what do we do? It should be stored in platelet agitator. Platelet agitator. So what is the platelet agitator? It is just a tray which is in continuous motion. Continuous motion. Kampti rahegi tray. The train will be continuously vibrating. Fine. So what is the benefit of continuous vibration? Platelets will always remain in motion. Will always remain in motion and they will remain suspended. They will remain suspended. So it is stored in platelet agitator. Platelet agitator. Fine. Okay. Now, there are two types of platelets. First is random donor platelets. Second is single donor platelets. Fine. Single donor platelet. Now, it is prepared, the random donor platelets, they are prepared from freshly donated blood bags. Freshly donated blood bags. So they are taken from 5 to 6 unit of whole blood. Taken from 5 to 6 unit of whole blood. Single donor platelet concentrate. Let's say this is your donor. Now, what will you do? You'll take the blood out. This is your donor. You will take the blood out, send this to a machine. We'll send this to a machine. Fine. So this machine, what will this machine do? This machine will remove platelets. Fine. And then it will send the blood back to the patient. It will send the blood back to the patient. Fine. So this will remove the platelets. So the platelets which are removed, they can be collected. They can be collected. Fine. So this process is known as plasma pheresis. This process is known as plasma pheresis. So this is certainly better. Why? This is called as single donor platelet concentrate. Why it is better? First, infection risk is reduced. Secondly, because they are from single donor, fine, they are not destroyed rapidly. So they are considered 8 times more effective than random donor. They are considered more time effective than random donor platelets. They're considered 8 times more effective than random donor platelets. Random donor platelets. Fine. So this is these were the different components of blood. Different components of blood. Just a minute. We are missing one thing. What are the triggers? What are the triggers when you should give platelets? Fine. So first, indications. So they are given if the count is below 50,000 plus a major surgery is planned. Second, they are given if counts are between 10,000 to 30,000 plus there is risk of bleeding. For example, the patient has piles. He can bleed anytime. Patient has esophageal varices. Patient शराबी है, खून की उल्टियां कर रहा है, ऊपर से डेंगू हो गया उसको. Fine, so he can bleed anytime. Plus, there is risk of bleeding. For example, esophageal varices. For example, patient has aneurysm inside the skull, inside the cranium, brain aneurysm. That can rupture anytime. Third, if the counts are below 10,000, so there is a risk of spontaneous bleeding. There is a risk of spontaneous bleeding. Right? So even if there is nothing done, you must give your patient, even if there is no risk, you must give your patient platelet because the bleeding can occur anytime. Fine. Now, last 5-10 minutes. Okay, not 10, but last 5 minutes. So let's read only one or two complications of blood transfusion. In the next class, which will be at 4:30, I will continue from this topic only. I'll give a brief and then I'll continue from this. Because, जिन लोगों की 4:30 बजे आज क्लास है, वो सभी लोग बैठे हैं इस समय क्लास में या नहीं?
Sir, आज कोई क्लास?
Yes, sir.
Yes, sir.
Okay, right. So I will continue from this only ताकि कुछ benefit मिले हम लोगों को. So the most common complication is FNHR. That means febrile non-hemolytic reaction. Febrile non-hemolytic reaction. Fine. So it is defined as increase of core body temperature more than 1 degree after transfusion. Fine. So if before the transfusion, my body temperature was 98, and after you gave blood, it becomes 99. Fine. So what is the pathology? Why does this happen? Pathology is graft. That means the blood versus host disease. Graft versus host disease. That means it occurs from leukocytes in the blood. Fine. Cytokines are the chemicals which cause fever. So cytokines are released during storage. It can also occur due to infection. That is why it is common with platelets. Why? Because they are stored at room temperature. Fine. So what is the treatment? Stop transfusion and give your patient paracetamol. Your patient will be fine in no time. Fine. The second complication is allergic reaction to donor plasma. Allergic reaction to donor plasma. So for that, we give antihistaminic drugs and steroids. Antihistaminic drugs and steroids. The most lethal complication is hemolytic reaction. That means destruction of blood. Hemolytic reactions, and they occur from ABO grouping mismatch. That means patient's blood group was A positive, and by mistake he was given B positive blood. Fine. ऐसा होता क्यों है? The most common cause is clerical error. So there were two patients, Mahinder Singh and Mahinder Pal. A positive, B positive. Fine. Because their first names are similar. Fine. So accidental exchange occurs. Fine. Now they ask, what happens? How do you know that you have given wrong blood? So if the patient is conscious, let's say this is the arm of the patient and this is the vein through which you are giving blood. Fine. Now, so let's say these are the RBCs of patient. Fine. And they are having green colored flag. Green colored flag means they are A positive. Just समझने के लिए. Fine. Let's say these are the RBCs from the donor blood and they are having red colored flag in their hands. दोनों एक दूसरे को देख के लड़ पड़ेंगे आपस में. Fine. So what will happen? They will clump with each other. Fine. So this reaction is exothermic. So conscious patient will say that I am having pain and warmth in the vein being used for transfusion. Pain and warmth in the vein being used for transfusion. Warmth. मैंने अभी बताया ना, दोनों लड़ पड़ेंगे, गर्मा गर्मी होगी. तो जब गर्मा गर्मी होगी, patient will say, I am feeling severe pain and warmth in my vein. Fine. Now, the second, if the patient is unconscious, see, A positive RBC, B positive RBCs, they clump with each other because they are destroyed. Now they clump with each other. Now, when they are destroyed, they clump with each other. लड़ने से पहले हम लोग इंडियन हैं, पाकिस्तानी हैं. फाइन. लड़ने के बाद अगर अनफॉर्चुनेटली इधर के या उधर के दोनों के फौजी शहीद हो गए, बाद में तो दोनों को डेड बॉडीज ही बोला जाएगा. Fine. Same way, when they are destroyed, they clump with each other. Now what happens is they block the kidney pores. Technically speaking, they block the kidney tubules. Fine. So they will block the kidney tubules. So in unconscious patient, how do we know there will be rapidly decreasing urine output, and there will be hemoglobinuria. Fine. How do we treat it? Last thing, but last 1 or 2 lines of the lecture. The treatment is by diuresis. What kind of diuresis? We do forced alkaline diuresis. That means we produce large amount of urine so that the clump can be diluted. Let's say this is the normal amount of urine. Now it will have many clumps. If we produce large amount of urine, the clumps will be diluted. And they will pass away easily. Now, why do we alkalinize the urine? Normal urine is acidic. That means H positive ions. Now, the proteins, they have negative charge. So they will attract each other. If we make the urine alkaline, it will have bicarbonate ions. Bicarbonate ion has a negative charge. So what will happen? They will repel the proteins, and the proteins will be forcefully thrown out. That is why it is called as forced alkaline diuresis. Right? So with this, we stop today's lecture, and tomorrow's lecture the time we will convey. And Sham wali class mein isi se continue karenge, if you are okay with it. And if you are not okay with it, do convey your moderator and we'll discuss it.
Sir.
Yes, sir.
Sir, I had a doubt. In the material that you shared, it's given that RHD plasma can be used in RHD negative mother. So we have to give Rogam before.
Beta, we have to give
Rogam. Like, how is it possible?
See. That is to be used in case of emergency. If required, we can use it in case of emergency. RHD, repeat the line again, beta.
RHD plasma can be used in RHD negative mother.
So if it is life-threatening emergency, you can give anything. Fine, you will give it in the next time. देखो उस समय उसको कोई problem नहीं आएगी. The patient will not have any problem in the first time. Only when you repeat it, then she might develop problem. But उसके लिए भी हमारे पास drugs हैं, उसके लिए भी हमारे पास. So it can be used immediately. For once, it can be used.
Okay.
Right?
So
we'll just leave. Yes. Any other doubt, please?
सर rhesus factor का कोई रोल रहता है इसमें ट्रांसफ्यूजन में?
Of course होता है, लेकिन मैंने आपको क्या बताया कि जो hemolytic reaction है most lethal है अगर ABO grouping mismatch हो. लेकिन अगर rhesus factor का भी हो तो उसमें भी lethal transfusion reaction हो सकती है, लेकिन वो ज्यादा life threatening नहीं होती. वो मैक्सिमम क्या करेंगी, थोड़े से RBCs को डिस्ट्रॉय कर देंगे और आपके पेशेंट को जॉन्डिस हो जाएगा. It is not so severe. Rhesus factor is a RH factor only, na?
Yes, sir.
Positive or negative, उससे भी हो सकती है hemolytic reaction, but they are not very severe.
Yes.
Right?
Right.
Okay. Any other doubt, please? चलो. Have a good day. मिलते हैं कल फिर से.
Thank you, sir.
Right, buddy.
Thank you, sir.